Thank you for staying with us on Business Nigeria. And to our second conversation of today, the National Health Insurance Authority has announced a new initiative to improve health insurance access for vulnerable groups across the country. NHIA Director General Dr. Kelechi Ohiri said this in Abuja, and this initiative is aimed at expanding coverage for persons living with HIV and TB patients, and it will be implemented across 5 Nigerian states, namely Kwara, Gombe, Ebonyi, Anambra, and of course, Lagos State. Also, the NHIA said it has enrolled 2 million people in 9 months of 2024 in the National Health Insurance Program, bringing the total number of enrollees to 19.18 million. Well, to help us understand this and take us through some of these numbers is the Director General, Chief Executive of National Health Insurance Authority. Thank you so much for joining us, Dr. Kelechi Ohiri. He joins us from our Abuja studio. It's good to have you join us on the program.
Thank you, and good afternoon, and it's a pleasure to join you here today. Thank you for having me.
So first of all, you started with something really interesting. You've been focused on improving maternal and sexual reproductive health in Nigeria, and we know of VVF centers that are being built and expanded. But can you give us insight into how NHIA is able to ensure and protect the vulnerable ones in Nigeria?
Thank you for the question. And I think in responding to that, it's really important to contextualize what the health sector agenda is and how NHIA is situated in helping drive the agenda of His Excellency, Mr. President, who made universal healthcare coverage one of the priority areas of his administration. And the journey started with first the launch of the Health Sector Renewal Investment Initiative. This was launched by the Coordinating Minister for Health and Social Welfare, and that sort of set the path and the direction for the entire sector. And one of the aims of that is how do we actually enhance financial access to all Nigerians, and in doing so, ensure that even the poor and the vulnerable are also carried along. And it is based on this framework that the NHIA, under my leadership when we came in this year, articulated a vision to enhance financial access to all Nigerians. And to do this, we articulated 4 pillars. The first pillar is to actually expand coverage for all Nigerians. And Nigeria has historically had low coverage. And what that means is that a lot of people pay out of pocket for healthcare. And you can imagine, if you don't have much in your pocket, that means you can't afford healthcare. And that means it disproportionately affects the poor. I'll speak to that in a bit on what we have done to expand coverage. But the second pillar, which is where your question is nested, is around equity and how we address the issues about the vulnerable. And the issue was that before now, health insurance typically was driven by coverage for the formal sector, those who were employed, those in the organized private sector, and the poor were being left behind. And so in the NHIA Act, it established a vulnerable group fund for ensuring that those who are poor, those who are vulnerable, like the internally displaced persons, the elderly, etc., are also brought under health insurance coverage. And the equity aspect of our vision is trying to address that. And then we also know that Nigeria suffers from one of the highest maternal mortality ratios in the world. And the minister articulated a vision to crash and reduce maternal mortality. So this presented us with an opportunity for actually killing 2 birds with 1 stone. One, addressing the leading causes of maternal mortality and morbidity. So why do women die? And even for those who don't die, what do they suffer from? And so doing so, and how do we ensure that they're also protected financially from the cost of healthcare?
I was going to ask you to just take a pause on those interesting thoughts while we go on a short break, right? Just stay with us. Thank you for staying with us. If you're just joining us, you're watching Business Nigeria, and we're on to the second conversations already. And it's very interesting because we're talking about how to make healthcare accessible for all Nigerians. And we have in our Abuja studio Dr. Kelechi Ohiri. Is the Director General of National Health Insurance Authority. Thank you so much for staying with us. You were talking about something really interesting, and I remember a story I covered in Kano State about child brides, and most of these child brides were, of course, suffering from VVF, right? And you were talking to us about how you've expanded some of the centers, that VVF centers, you've built and expanded them in various states across the country. But the question in my mind is, how will this Nigerians, particularly those in rural areas, access healthcare, quality healthcare now?
Thank you very much. And as I was saying earlier, one of the pillars of what we're trying to do, thank you very much, is ensure that those who are poor and vulnerable have access to care. One of the pillars of and it's one of the pillars of what the NHIA is doing on equity. And I'll just give you three examples. Have access to care. The first is about the VVF, and what we're doing is that we're working with community-based organizations to ensure that there's outreach. And when we identify VF people and what we're doing require these services, working with community-based organizations to ensure that there's hospitals that provide care. And when we identify care is paid for require these services by the NHIA, when they show up, in addition, we ensure that they have so they can space the next childbirth. And then thirdly, we ensure they are enrolled in health insurance, working in partnership with the states. This way, any subsequent health need or any subsequent pregnancy, then they have access to good quality health care. The second thing we're doing is that we're extending the same intervention to women who have complications that could lead to death in pregnancy. So it's called, there are 5 leading causes of mortality in Nigeria, and we're addressing everyone. The third one is something called the Basic Healthcare Provision Fund. This is federal government funding that ensures that poor and vulnerable Nigerians have access to health insurance, working in partnership with the states. At the moment, at least 2.4 million Nigerians are covered under this scheme. Most dwell in rural areas and in communities. They are those who are poor and who have other forms of vulnerability that we have determined. Now, in order to make sure that these services reach people, we're working together with the National Primary Healthcare Development Agency, where we have joined forces to ensure that primary healthcare centers in communities are upgraded and accredited, so to provide the minimum package of services for those things that most Nigerians suffer from in the communities. So that's what we're trying to do, to make sure that we get these services to the communities, that they have access to it. But also, now when they get there, they don't have to pay out of pocket, and we get there. Now, we're starting from a low base, and it will take time to get to the point where all Nigerians get covered, but we're making tremendous progress. As you mentioned, this year alone, over 2.5 million Nigerians have been added from a baseline in December 2023. There are about 16.7 million Nigerians covered by any form of health insurance. Today, that number is about 19.18. So we've seen a rapid increase. And this is largely due to the prioritization of financial access by the government under the leadership of the Coordinating Minister for Health, the collaboration with the state health insurance schemes, where the governors have stepped up to begin to ensure that the poor and the vulnerable in their respective states are covered through health insurance. And so I'm optimistic because I know that even though the journey is long, we're making tremendous progress, and we will see this continue to benefit Nigerians, particularly those who are poor and vulnerable.
Key into this, because having 19.1 is pretty low for a country like Nigeria. Our population is about 200 million.
Yes, it is quite low, but you have to also realize where we're starting from. And there are interventions being put in place to ensure that we have more of an exponential increase in those numbers. Like I said earlier on, we used to have a situation where the rates of insurance coverage in Nigeria was below 4%. And as of December 2023, where we tried to establish a baseline, the number was about 16.7. In 9 months, we've added 2.5 million people to health insurance coverage. But beyond that, the cause of optimism is that there are policy reforms in place. One is that the NHIA Act of 2022 has made health insurance mandatory for all Nigerians, which means that we expect that with more awareness, with the enforcement of the mandate, and the rebuilding of trust in the healthcare system, more and more Nigerians will begin to embrace insurance as a veritable tool for financial protection and for coverage, which is better than having to always dip your hands in your pockets and pay for care at your most vulnerable moments, which is when you actually need care. And so with more awareness and more partnerships and the mandates behind our backs, I think we will begin to see a rapid increase in the number of people who are enrolled in Nigeria.
So what's the role of subnationals now? Because I know that you're over there in Abuja. It might be difficult for you to actually understand the intricacies or the peculiarities of each state. Talk to us about the role of subnationals and how you want to leverage on state collaboration in ensuring that more people enroll in the health insurance scheme.
I think the role of the subnationals has been one of the critical success factors of this. When I started my role, there were still a few states that had not yet set up state health insurance schemes. I'm happy to tell you that right now, every single state in Nigeria has set up a health insurance scheme backed by law. So, and in doing so, they are beginning to ensure that their citizens and residents in those states are increasingly covered. And I think they play a major role. And a lot of my time is actually spent collaborating and working with them. I've been to quite a few of the states, and I've seen a lot of the hard work being put in by the chief executive of the state health insurance schemes and the support, the political support that their governors have provided in either enrolling those in the formal sector, but also in beginning to contribute funds called equity funds, so that the poor and vulnerable are also covered in those states. Of course, more needs to be done, and the advocacy for that is still ongoing to make sure they do. But we see them as critical partners in this journey to ensure that all Nigerians have health insurance. And NHIA, in its enhanced role as the regulator of all schemes, but not just that, but also one that integrates and promotes health insurance, is one that we've taken really seriously and ensuring that we continue to advocate for a better way for financial protection, and we continue to work with the states to ensure that we all live up to obligations to Nigerians by ensuring that the hardship that is caused by lack of access to financial access to healthcare is something that we will begin to address and begin to put behind us. So to answer, just to summarize your question, the states have a critical and pivotal role. And that's one that we have embraced, and we're working together with them to make sure that this agenda of universal healthcare coverage is one that we will move closer and closer to.
One major concern for a lot of people is money. Like, the issue of financing is very key. And the question is, does the Nigerian government have the quantum of finance to actually required, to cover nearly 200 million Nigerians?
Thanks. And I think it's a very important question, really, because when you think of insurance, there are, or financing healthcare in general, you think of three things. You think of, one, how you mobilize resources. You think of the way you pool risk and pull those resources together so it goes further. Because the way insurance works is that at every point in time, those who are well are inadvertently subsidizing those who are sick at that particular point in time. And because of the model we have taken in Nigeria, those who have more cross-subsidize those who have less. So that way the money goes further. Now, in terms of resource mobilization, every country deals and struggles with this, and it's not a problem peculiar to Nigeria. And there are different ways. Under the Basic Healthcare Provision Fund that was signed into law through the National Health Act, 1% of consolidated revenue is plowed into primary care. Roughly half of that goes into financing health insurance. And right now, it's at least covered almost 2.5 million Nigerians that are benefiting from this. Secondly, there's the establishment of the Vulnerable Group Fund, which is targeted at the poor and vulnerable. And this is meant to pool resources from multiple sources to ensure that, funds that are targeted at the vulnerable are there. But also premium contributions from salaried workers and from also the informal sector are ways of contributing into this pool. So I think every country goes through this process of gradually getting to universal health coverage. Nigerian government has committed resources and can commit even more resources to healthcare. And I think, that's the path that we're on. And it will take some time, but I think we're definitely on the right path because this has been made a political priority. And this is one where resources have been earmarked and are continuously channeled towards the right targets, which are the poor and vulnerable Nigerians. And we're seeing that happen.
I was going to ask you about some of the biases because I know people may be biased about how to enroll, what to do. Just if my director would allow, just briefly talk to us about the steps that Nigerians can take like almost immediately to enroll in NHIA in this scheme. Very quickly. We do not have so much time.
Thanks. And I will start and say that there are many schemes in the country. And for the poor and vulnerable, please, the state health insurance schemes exist. And the NHIA also has programs that exist. If you're formally employed through your employer, your salary deductions will contribute, and then you can go to any of our centers across the country. We have offices in every state, and just go in and you'll be able to sign up. And the same thing with the states. But we're moving towards a situation, and in the near future, you'll see where you will be able to enroll online and also through mobile apps down the line. But right now, we're still at a point where we have centers all over the country, and you can go in and enroll, and someone will attend to you. You can also avail yourself of the private health insurance providers, HMOs, or the state health insurance schemes. So there is no scarcity or dearth of health insurance organizations that can ensure that Nigerians sign up and are enrolled in health insurance. And we are working towards making this easier and for people to access and for people to buy into as well. Thank you.
Dr. Kelechi Ohiri, thank you so much for helping us understand how important it is to enroll in the health insurance scheme. Hopefully we get to bring it back to help us, break it down some other intricacies for us. Thank you so much for spending your time with us on Business Nigeria.
Thank you. It was my pleasure being here, and thank you very much for having me.